Assalamu alaikum and a very good morning. Thank you for the nice introduction about me. Can I have my slides, please? I'm sharing about female mental well-being, not because I'm a feminist, but as a woman myself, I am considered myself as educator. I'm a mother. I'm a wife. So I have a lot of uh, uh, things going on in my during my lifetime that I myself have gone through a lot of stressful life events. So besides sharing my myself as the one that with these problems, I also shared myself as a psychiatrist that have treating a lot of problems related to female. So next slide, please. So mental well-being is defined as a state of well-being in which every individual realizes his or her potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. That's the definition of mental well-being. So as a woman, we have a lot of things going on in our life. So what is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stresses, relate to others, and make choices. Mental health is very important at every stage of life. Therefore, persistent low mental well-being may lead to a diagnosable mental health problems such as anxiety and depression. This is the most common mental illness that will be suffered from somebody who has involved with or who have low mental well-being in their lifetime. Next, please. So what contribute to mental health problems? So the most common things is biological factors such as genes or brain chemistry, meaning that you were born with that kind of problems that you are very vulnerable to have mental health problems. So it involves a lot of brain chemistry that will change your emotion or your behavior. Next is life experiences such as trauma and abuse, which is very common in women. And the next is family history of mental health problems, which is common for everyone. So women noted to have higher rates of depression, anxiety, mainly related to specific hormonal factors and life experiences. I will share later. Next. So why women? Women, depression disorders account for close to 41.9% of the disability from neuropsychiatric disorders among women compared to 29.3%, which is 2 times more common than men. And leading mental health problems in the older adults are depression, organic brain syndrome, and dementias, and a majority are women. An estimated of 80% of 50 million people affected by violent conflicts, civil wars, disasters, and displacements are women and children. Even though we don't have civil wars in our country, but I think we have a lot of students, postgraduate students come from other countries that involved with this kind of civil wars. So we have to look into that if they come from that kind of countries. And then lifetime prevalence rate of violence against women ranges from 16% to 50%. This is very high. And at least 1 in 5 women suffer rape and attempted rape in their lifetime. With all this fact that we have regarding women mental health, that's why women are more common to have to suffer from mental health problems. Next. So why women? Because women, we have something that very different from men. We have hormonal related factors, especially during pregnancy and postpartum period. We are 2 times higher than normal, meaning that if at normal time, we are 2 times higher than men. When we are during pregnancy or postpartum period, we are even higher in terms of getting mental problems. And post-menopausal period also will increase risk of developing depression and other mental illness, especially anxiety disorders. Then depression and anxiety and somatic symptoms and high rates of comorbidity are significantly related and interconnected and concurrent risk factors as gender-based roles, stressors, and negative life events experiences. Which is very common in women because we have multiple roles at home and also at workplace, and most of the women also very prone to have negative life events, as I mentioned before, such as traumatic event. So we don't know what happened in their life. Maybe they have problems with their family, they have abusive husband, they have uh, they come from a country where they were involved with civil wars, etc. And then gender-specific risk factors for common mental disorders that disproportionately affect women include gender-based violence, socioeconomic disadvantage, low income and income inequality, low or subordinate social status and rank, and unremitting responsibility for the care of others. We are lucky in Malaysia. I think women were treated um, almost equally to men, but not all. I think some of us still will be discriminated in some terms because I remember during my postgraduate studies, because I frequently pregnant during my postgraduate studies, I was sort of being labeled as something. So this is not nice to us as a woman, as a mother, as a student at the same time. Then the high prevalence of sexual violence to which women are exposed to the correspondingly high rate of post-traumatic stress disorder following such violence renders women the largest single group of people affected by the disorders. So that's why women are very common to suffer from this kind of illness. So as a woman, as a mother, as a myself, I consider as educator, even though not directly, because I'm also a lecturer to the USM students for postgraduate studies who are attending or who are attached to my hospital. So I consider myself also as an educator. So a lot of women suffer from this illness, but they are not no, they don't know where to go, where to seek the seek help. So next slide, please. So this is first intervention where we should give to this kind of problem to the women is psychosocial intervention. Psychosocial is the term used to describe a combination of factors that are responsible for the psychosocial well-being. So psychological effects are those that affect different levels of functioning, including cognitive, affective, and behavioral. Social effects concern relationships, family and community networks, cultural traditions, including life tasks such as school or work. Therefore, psychosocial support is important to maintain continuum of family and community-based care to prevent immediate or long-term mental health disorders, which is already mentioned by Dr. Ma and other speakers. There are a lot of supports given to the students. I think we should also support the educators or other workers that were in our community. So, like this at this pandemic time, psychological first aids were given to immediate after a crisis, includes emotional and physical supports that we have done in our country to support the COVID-19 family and the patient himself. So this is very important. Psychological first aid is like other first aid. It is the first psychological input or intervention that we should give to anybody who have involved with all sorts of problems in their life. So psychological supports, especially emotional supports, we should encourage the students or the educators or whoever involved with these current situations like COVID-19 to come forward to discuss with whoever already appointed for that. So once we manage to give them some kind of support, then they will reduce their burden of whatever burnout or whatever stresses that they have. So next, please. So if we can encounter earlier, the crisis by giving psychosocial intervention, the women may not be suffering from any kind of mental illness. So they may be able to cope with their problems and be able to live a normal life again. But I think not everybody are very good at expressing their problem, because they don't know where to go, because a lot of patients, they come at very late stage. Some of them suffer from, I have students who suffered from this panic disorder or anxiety, or some kind of anxiety disorder for the past 10 years. She was having that panic attack when she was in tingkatan 6, sorry, form 6. So she didn't get any proper referral to us. She seek treatment from traditional. So she's supposed to be the best student at that time. So, but because of this problem, after 10 years only, she came for help, which is very late and it's very difficult to treat. That's why, if you are suffering from this kind of problems, please seek for help. So when the illness became worsening and started to interfere with your ability to work or study, or sometimes you will have sleep problems, poor appetite noted to be hopeless and despair, or if you are students, your study will be deteriorating, and the symptoms persistent for more than 2 weeks. But I always see patient more than, the symptoms will be more than that. So then the person should be referred to a psychiatrist for further assessment. The person might have suffered from clinical depression. It can be treated if we refer them early. As for the anxiety disorders, which is also the most common disorders, the most common illness that I encountered was panic disorders. There are a lot of patients recently. They don't come forward very early, at a very early stage. Usually they already suffer, already having problems with their study, with their having problems with their works. So typical symptoms of panic attack are sense of impending doom or danger, fear of loss of control, rapid or pounding heart rate, sweating, trembling, shortness of breath, chills or hot flashes, which is sometimes be mistaken as having heart problems or having some kind of abdominal discomfort or gastric problems. So usually, of course, if you have these symptoms for the first time, you have to see doctor, at whether at the clinic or at the emergency department. So if you found these patients come to you frequently, even though she was or they were already explained that they don't have or they don't suffer any medical problems, then I think you should not tell them they don't suffer any problem. Actually, they are having some kind of anxiety disorder or panic disorder, to be specific, because some of them, because once the doctor say you have no any problem, then they think this is related to being charmed or they are being possessed by something. That's the common. That's why they went to see the traditional healers first rather than to see a doctor. So when the symptoms are recurrent and the person in constant fear, the condition is called panic disorder and required further treatment. This is always missed by most of the students and missed by most of the even patient themselves. They don't know they are suffering from some kind of illness that which is can be treated. So if you delay in terms of treatment, the symptoms will be getting worse and the treatment will be difficult, because sometimes when you delay in treatment, patients will think that this is or this is a real thing, that they are not, that this is not something that can be treated. That was the thing that I always encounter or with my patients. If they come at a very late stage, the treatment become very difficult. So I think a lot of things to discuss further, but I think time is not really enough for me to talk more. But I think that's enough for to trigger someone to, if you have any problem, you can ask later. I can share or give any advice if needed. That's all. Thank you. Pass back to moderator. Thank you.
Thank you so much, Dr. Fariza, Yahya, for very, very engaging sharing just now.